Hello everyone, I am Julia Casado, a graduate student of Biomedical Engineering and a current student of the Master in Bioinformatics in the Cairo Leuven University.
Hi, I am Jorge Lázaro, also a biomedical engineering graduate and a current student of the Master in Technological Innovation in Health of the EIT Health Community at the Universidad Politécnica de Madrid. And we are going to present our project Accompain that we are developing in collaboration with the Radiation Oncology Unit of the Hospital Universitario Ramón y Cajal. First of all, this project started when we observed how was the monitoring of the pain at the hospital, especially in patients with bone metastases. And due to the cancer, this patient suffers very severe and chronic pain that can interfere with their daily activities. So for this reason, it's very important to track it correctly. This process is mainly based on a periodic assessment to quantify the pain, and these evaluations take place every 7-10 days, and patient must travel to the hospital. So to improve the follow-up process and the communication between the doctors and the patients, we have developed a mobile app for monitoring the pain and the rescue medication in oncology patients.
This project provides a platform for collecting data in a digital way for a more continuous health monitoring, as we are missing a huge amount of data of the patient's health situation in the days they don't go to the hospital. All the collected data goes to the hospital databases, so they have a lot of information for correcting the treatment or even check that everything is working correctly. On the other hand, for patients, they can avoid unnecessary trips to the hospital, which is really important in patients that are suffering from chronic pains. Also, they have the security and the confidence that they are being treated with more information about their health situation, and they can participate in a more active way. After looking at other mobile applications and talking with oncologists that are working on similar projects, we have realized that the fact that we are collecting rescue medication is really important. This is because if the doctor detects that the patient is taking too much rescue medication, this could mean that the baseline treatment is not working correctly, and so maybe some changes need to be made, and this can be detected sooner. Also, we have developed a system that evaluates the data that is being collected, so the doctor receives a notification in case this data is of more concern and can contact the patient. This is certainly beneficial for the patient who receives a more personalized care, and beneficial also for the doctors who can focus on patients with more needs before those that maybe are not suffering that much pain at the moment.
We are currently in the process of creating our own startup and participating in training and business financing programs such as the Health Star Madrid to accelerate and lay the foundation of our company. And also our effort and dedication are bearing fruits, as we have won the first prize in the Santos Novartis Oncological Pain Challenge in the 6th Hackathon of Health in 2021. Furthermore, we have received the permission of the Hospital Universitario Ramón y Cajal to conduct a clinical study to validate our application, and we have received a positive feedback from both doctors and patients. In addition to the positive economical and environmental impact that our application can have in terms of optimizing the medicines and saving patient trips to the hospital, the main impact will be reflected in the long term, thanks to the data handled by the app, and not only in the quality of life of the patient, but also in the results of the health system. In the short term, the impact could be on the 1,800 patients treated annually on the Radiation Oncology Unit of the Hospital Universitario Ramón y Cajal, and in addition, the Rehabilitation Unit has shown interest in using Accompain. Regarding the implementation of our project, the app could be incorporated in existing e-health monitoring interfaces as a complementary module, or be established as a new tool in the management pain units of the private and public hospitals. So what is our vision for the future? Well, we want to continue working with the project to grow much more, and we know that applying for the EIT Health Call, it's a really good opportunity. And we need also continue talking with patients and doctors to improve the current section of our application, but also include new modules that covers other important needs.
To sum up, and as the name of the application itself indicates, our main goal is to accompany the patients throughout their illness and in order to have a positive influence on their day-to-day life. We hope you like our project.
Thank you for your attention.